Do you find that with the no hygiene model, it's easier to do same day dentistry because you're not bouncing all over the place?
Well, that is part of it, right? You have to do same day dentistry if you have a no hygienist model. But what a lot of dentists don't realize is
Now, with that hygiene model, let's talk turkey. What do people misunderstand about you the most?
that you're wasting your time on hygiene, yet they don't realize that all the money that we produce comes from hygiene.
Welcome to the premier podcast, The Blue Zone, the power of now and the currency of time. My name is Dr. Yvonne Beckford. A little about me: I am a practicing clinical dentist for 40 years, a graduate of Georgetown University School of Dentistry. I am a speaker, a podcast host now, and a retreat host. I'm everything, but I am nothing without this quote from George Bernard Shaw. This is the true joy in life: being used for a purpose, recognized by yourself as a mighty one, being a force of nature instead of a feverish, selfish little clod of ailments and grievances, complaining that the world will not devote itself to making you happy. I am of the opinion that my life belongs to the whole community, and as long as I live, it is my pleasure and privilege to do for it what I can. I want to be thoroughly used up when I die. For the harder I work, the more I live. I rejoice in life for its own sake. Life is no brief candle to me. It is a sort of splendid torch which I have got to hold. I have got hold of for the moment, and I want to make it burn as brightly as possible before handing it on to future generations. George Bernard Shaw, he was born in 1857 and lived to 1950. That's 97 years. That's the Blue Zone. I am very, very, very fortunate to have my very first guest, Dr. Shefdor. He is a 1983 graduate of Southern Illinois School of Dental Medicine. He has practiced for 37 years in a fee-for-service setting.
Yeah.
It had 3 locations in Chicagoland area and a staff of 30. He decided to open a low-stress office with few employees so he could spend much more time with patients. That's what it's about. For the next 20 years, Dr. Shefdor developed Celebrity Smiles of Chicagoland. Dr. Shefdor appeared in many media outlets, including CBS, NBC, Fox, U.S. News and World Report, and my podcast. Okay. He has been featured on the cover of Dentistry Today magazine, the American Academy of Cosmetic Dentistry, top doctor in CE for dentists by Dentistry Today magazine from 2006 to 2014. Dr. Shefdor retired from clinical dentistry in 2020. He is currently president of Doctors Coaching Systems and Pharmadent Nutraceuticals. He teaches dentists how to successfully work to create purpose, a purpose-focused and satisfying practice. What more can you ask for? Dr. Shefdor, thank you, thank you, thank you for coming to hang out with me.
Oh, thank you so much for having me and asking.
I know. I mean, it's a heck of a thing when you ask somebody something and it's like, I got you, no questions asked. So I appreciate it.
Oh, you're
Um,
welcome.
this particular podcast is going to have a similar theme with different people of all backgrounds, and the theme is purpose. Okay, because purpose leads to longevity and health. And what I want to ask you, my friend, is what was your purpose in your 20s? And then we'll move to your purpose now. And let's talk about your purpose in the future. Talk to me, man.
Well, when you're young and dumb, you learn. You make mistakes and you learn. And in my 20s, graduating from dental school or college, you want to strive to be the best or an A student.
Right.
and you get into dental school, and you still want to be the best. And when you get out, you want to build your empire,
Right.
right? And no, the mistakes that are made in your 20s is not having a coach or somebody senior to you to say, it's a little bit more than that. Let's talk about your purpose and the confidence that you have. Nobody ever talked about that because you go through dental school, they just beat the crap out of you, and then
Mm.
you get out of school and you don't know what you're doing business wise. And I find me and many dentists, the confidence was not great, and the purpose. Well, okay, we want to build an empire. We want to make as much money as we can. Sure, we want to treat patients and take good care of them too, but
Right.
it gets all garbled, and sometimes the money becomes more important than patience, and just
Exactly.
everything gets mixed up, right? And we're seeing this a lot today with this PPO, high volume dentistry. Is it about patient care and really helping another adult? They're not patients; they're just helping another adult,
Correct.
and
Dealing with humans, man.
deal with humans and
Hmm.
have adult conversations with them,
Right.
and not delegate it to some staff. I mean, you're the most educated person in the office, and you spent the most time and the most money to get to this location. Yeah, money's fine, but there's something way more important. So in your 20s, I didn't really know that.
Yeah. The mentorship point that you bring out is well. We hear it from physicians, lawyers, everyone. They're taught the trade, but we're not encouraged the connection that will support the trade. Correct?
Yeah, you're not going to do the trade too long if you're pretty unhappy, and
No, exactly.
it goes with my
Exactly.
story too.
So after what is it? Was about 20 years or so? Would it be safe to say that you hit burnout?
Yeah, I actually hit burnout about year 15.
Okay.
I was starting to teeter a little bit around year 12, I'd say. By
Hmm.
15, pretty well burnt out. By 17 years, I couldn't go into the office. Now, keep keep in mind, this office, what we had built, was an out of network, 3 offices, 3 locations. We owned the real estate. This thing was humming. We
That
had
was pretty impressive, man.
30
Yeah.
staff. That many years ago, there was very few people doing that.
Hmm.
And you would think everything was great. The empire was being built. And as it became bigger, I became way more miserable and miserable. Well, couldn't do it anymore.
Right.
And thank God somebody came along and offered me some stupid money, and the associates wanted to buy. And I said, absolutely. Oh, geez,
Bye.
break my heart.
Hmm.
It's all yours.
So what brings you to present? So you sold it, you went for a smaller model with which valuing time, so you got to spend more time with patients.
Yeah,
Safe to say.
it wasn't quite that easy.
Okay.
It took me a year, and thank God I married a smart woman. She said, geez, you got to take a year off and figure this out and what you want to do when you grow up.
Right.
And
Right.
so during that time, I looked at other businesses because, right, you want to run away because
Hmm.
basically you don't know how to run this business. Even though financially it was successful,
Right.
it wasn't successful for me as a person. And so I looked at other businesses and realized I'm just running away. I go, I love helping people. And why don't I just hang my hat on that and figure out? I developed, my wife and I developed these questions. In fact, I still give them to doctors today. There's 12 questions. I
What are
sat
they?
down and really did some soul searching and answered these 12 questions to develop a business that would suit me and feed me what I needed. And money was secondary because we already made the money, right? It's only
Right.
42 years old, but somebody already bought out 3 practices. And I sold the buildings too. So the money part was kind of taken care of, thank God. So I could focus on why am I not happy or satisfied? And how can I balance this professional and personal relationship I have with dentistry and do what I want to do?
In
And so
relationship with yourself, correct?
exactly, and that's I had to figure out what I wanted to do. And these questions really help streamline that.
Share a couple of them with us, would you?
Well, sure, simple
Hmm.
things. Where do you really like to live? What kind of climate do you like? You know,
Hmm.
what's your personal life? What's a
Mhm.
perfect personal life? What's a perfect day in the office? What kind of treatment do you actually like to do? Give me the 5 top treatments you like to do, because what I realized, if I stick to those 5 to 7 top treatments I like to do and do more of those and
Mhm.
not do the ones I don't like, I was
Right.
much happier.
Yeah. And it's profitable, ironically, because you're happy and you
It
don't
it
mind being
become
there.
it becomes more and more profitable, and there's a
Mhm.
lot of studies on this if you look it up,
Mhm.
speaking of the, blue zones. If you're doing things that you like, you automatically are more productive and more profitable in those areas. Just like I started the no hygiene, no hygienist, not no hygiene, but
Mhm.
a no
Right.
hygienist model
Mhm.
on that second 20 years after I answered these questions
Mhm.
because I wanted to spend more time with patients. Everybody told me there's no way you're ever going to make a profit on it. You're wasting your time on hygiene, blah 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 blah. It just yeah, okay, get out of my way. And so, the first year I took over a real struggling office.
Mhm.
And in today's dollars, the first year we went from like 300,000 to 750.
Wow.
I
That's
wasn't
impressive.
trying. I really was not
That's
trying.
impressive. Yeah.
The second year we went up to like 850. And the third year it was like a million. And we stayed there for the next 17 years.
That's impressive, man. The do you find that with the no hygiene model, it's easier to do same day dentistry because you're not bouncing all over the place?
Well, that is part of it, right? You
Mhm.
have to do same day dentistry if you have
Mhm.
a no hygienist model. But what a lot of dentists don't realize is one, there's rules to follow if you're going to do a no hygienist model. You're not going to be cleaning teeth all day. That's just stupid.
Mhm.
You have to limit them. You have to
Mhm.
learn how to diagnose and present to patients. But what you're going to find is when you're involved in some of the recare, because I work with a certified dental assistant,
Mhm.
um, is that you're going to find a lot more dentistry and a lot more education. You're not selling anything. You're educating people
You're
on what the
diagnosing.
problems are and a couple choices.
Correct. Right. I agree with you. And there's more than one way to do things. It doesn't make anything wrong or right, but what works for you. And yeah, so I'm with you with that. So this is was that was your we're getting into your present, right? As far as purpose,
Yeah.
what's the future looking like? Because you're definitely impacting the next generation, according to our friend Bernard Shaw. Right.
Yes, I am. And that torch he was talking about, I want it to
Uh-huh.
burn bright, use me up. And in my personal life, I kind of have that same thought with my grandkids.
Mm-hmm.
Hey, use me up. I'm going to do everything I can to make life as
That's your
nice as
legacy,
possible.
man.
Yeah,
Yeah,
right.
exactly. Yeah.
And I do that with dentists, but I have to balance my time with that, right? Because I am retired.
Mm-hmm.
And so 15 to 17 hours a week, I work with dentists
Mm-hmm.
and some for some months, but mostly 1 or 2 sessions to get them on the right track to talk about how they can quickly change what they're doing. Because every day, almost every day, I get a call how unhappy they are with dentistry. They're ready
Yeah.
to quit. And it was the opposite for me the last 20 years of practice.
So it's
So
not retirement, you rewired. That's my big thing with my retreat. That I think retirement, the term is an American term. In the blue zone, no one really retires. You change season, so to speak. Is that fair to say that
you're in
because you're
sync. Absolutely. The blue zone, one of the things that you must do, or that they do in the blue zones, and I do too, and I found this by accident, is a strong social connection.
exactly. Yes.
So I have that not only personally, my grandkids live across the street for crying out loud, my
That's
son's down the
wonderful.
street.
That's wonderful. Yeah.
And that it opens up a whole nother, personal social connection. But it's nice to have a professional social connection too.
Yes, yes. The when you mention your grandchildren, there was another quote that when we have our next generation, meaning your grandchildren, don't focus on giving them what you didn't have. Focus on teaching them what you weren't taught. How does that resonate?
It's exactly
I'm deep, ain't I? Yeah.
teaching and chores and just how to be a happy human being. How because 99% of people all want love. We all want understanding. We all want the same things, but we're very driven with marketing to get all these things. We got to have the fancy cars and serve our egos,
Right.
and it just is it leads to misery.
It does. It really does. And with that, on that thought, one of the reasons when I do these retreats is because I find commonality. As a matter of fact, that's the theme of it, that there's a connection of purpose when scenery changes and guards are down. And that's part of community. Honesty and commonality and authenticity flourishes. We listen to hear, not to respond. Hopefully, I was listening, right? And I was. Diversity retreats of occupation, age, gender, and culture recognizes the community of commonality of frustration. And I think you pointed out that it's not unique to dentistry. When I've done these retreats, I've had attorneys, I've had pilots, I've had the staff at the resort. Everybody's saying pretty much the same thing. Me personally, I have a problem when people say there's certain taboo subjects. It's taboo because you're not communicating. You should
That's
be able to talk about anything. It's kind of like taboo food.
right.
I mean, unless you're allergic, try it. You might like it. You don't have to have it forever, but how does that sound?
I never met a food I didn't like.
I know. Well, I have, but we won't go there. That's all. I gotta stay on the track, stay on the lane. Okay. But that's the main thing. So what purpose do you think you can leave your grandchildren, since we were talking about that? We talked about happy, but what does that mean to you?
Well, they need to find what excites them and what their purpose is, not mine. I could tell
Right.
them what my journey is and how I developed what was exciting to me so I could develop what my purpose is. Because all of us have little different purposes in life and we all
Mhm.
have different talents.
Right, right.
And so I'm helping them discover throughout their life what their talents are that God gave us.
Uh-huh.
And maybe that's a hint of maybe that's the things that might excite you and you might do real well with. And when they're
Oh, cool.
young, they're not really good at much because their bodies are uncoordinated and their minds are still developing. But it's kind of funny by 8, 9 years old, there's you could start to see and they could start to see what they're good at already.
Isn't that wonderful?
Yeah.
Now, with that hygiene model, let's talk turkey. What do people misunderstand about you the most?
Um, that you're wasting your time on hygiene, yet they don't realize that all the money that we produce comes from hygiene.
Mhm.
So why would I go into a room and spend 2 minutes on an exam when I could spend 30, 35 minutes on an exam and find a lot more work and do a lot more meaningful oral health that affects their overall health? Why wouldn't I spend more time doing that if my purpose was to get every person through my door healthy? And I
Right.
don't mean just orally healthy. Oral is part of it, but because I can show them through dentistry, getting their soft tissues and hard tissues healthy, how that affects the rest of the body.
Yeah, I personally don't think you have a problem with hygienists. I think they interpret it wrong. I think you just have an issue with there's only one treatment model. Is that safe to say?
Yeah, I
Yeah, I
mean,
mean, because you can do what you want. I mean, there's going to be a room. I mean, this is my personal opinion. Folks will come in from some of the chain DSOs and this, that, and the other. I mean, there's something for anybody. If I was 19 or 20, I could go to a DSO. The only thing that could happen to me is cancer, pregnancy, or I fall. But as you get older and you want more time, and your health issues are a little bit more complicated, I'll pay for more.
yeah,
I'll pay for more, so I'm not saying they're only supposed to handle pedo, but there's different ways. It's kind of like, what is someone asked me, a patient asked me a long time ago, what was my favorite uh, Bible saying? And I told her that I see religion as language. I don't particularly think French is better than Italian or English is better than German. Everyone's pretty much saying the same thing. So when we're talking about healthcare, your treatment model is not the only one. It's not like you're excluding. So when I say, what do people misunderstand the most about you? I think they're interpreting that your way, what you're saying is your way is the only way. And I don't think that you're saying that. Am I correct?
No, it depends on what your goals are.
Okay.
My goal was to get our patients as healthy as possible.
Right.
And so I wanted to keep control of that
Right.
and delegate, like doing the 2-minute exam. And I've done this with so
Yes.
many doctors now. I challenge any doctor.
Yes.
I'll fly to your office and I'll prove this point
Mhm.
that if you're this 2-minute doctor guy on an exam and you delegate most things to your staff, when you're done with your exam, I'm going to follow you in.
You're gonna underdiagnose, I already know.
I am going to diagnose $10,000 a week of stuff that you missed and get
Mhm,
patient acceptance on it that you didn't
mhm.
even talk about.
Right,
How is that getting the patient healthier?
right. I
And
got you.
that's my goal. I don't care what business model you get, but if you can't spend time, the most educated one in the office,
Exactly.
to do what you're supposed to do, and it takes more than 2 minutes if you want a comprehensive exam. It's
Currency of time.
and and help the patient understand the significance
Mhm.
of your findings and explain your choices.
Right. Currency of time. You gotta money is time, time is money, and time is the only commodity that we don't know the balance.
Yeah, I have 0 against any hygienist. I mean,
Right, no, yeah, I know that. I
it's
know that. I want it to be known publicly.
yeah. Yeah, I didn't want to do, volume dentistry and chair hopping. That was just like, I'm not
Right,
gonna be interrupted when I'm with a patient.
right.
It's not gonna happen.
And it's
And so
appreciated.
so when you're with a hygienist and you're chair hopping, seeing 20, 30, 40 patients a day and doing 2-minute exams, how is that the best care for the patient?
Right. I got you. I got you. So is it safe to assume, well, you tell me, what was your biggest regret thus far? Not necessarily in dentistry, just in life.
Oh, well, I just think this goes with being young,
Hmm.
not realizing when you're young what you know when you're older. I mean, I wish I did some of this purpose and confidence in dental school, that somebody
Hmm.
sat down and talked to us before we graduated to say, let's pick out a business model that might be best for you.
Right. Yeah. And I think as you very well stated, I've gotten into sleep medicine and I've been seeing a lot of truckers, and when I communicate the value of balance, I'll say, which one of those 18 wheels can you go without?
Yeah.
So it's kind of like life. There has to be a balance. And I think that's what you're doing as far as coaching a lot of the young dentists about, what's important to them, the climate where they work, the type, are they, do they want to have children? All these things come into play. No matter what your profession, I don't think
Yep.
it's unique to dentistry. I think because we're in a bit of an aquarium. We don't really get to talk to other professions unless there are patients, so to speak. And to see that there's a lot of similarities and in the frustrations that everyone is having. But I appreciate the conversation. Anything you want to ask me or anything else that we missed? Because I mean, I'm just enjoying talking to you. I'm
Well,
talking to you're a movie star in dentistry, and
well,
I've been
thank
at
you.
it a long time, but let's just say the doors weren't always as open for me to have these kind of conversations. So I'm taking full advantage of it. So I appreciate you.
Well, you're welcome. Well, you didn't know me. My door's always open to you.
Oh
You
yeah. Well, I mean, I hope I've found a new friend, and I maybe you'll come on one of my retreats. That would be great. Because you've got so much to offer. I know that a lot of in dentistry, big money in coaching, but there's something to say about mentoring.
Yeah.
I know in a lot of churches, young married couples are paired off with older married couples so they can kind of see. that everything ain't gravy, but there's a lot of free advice if you just listen. Am I correct?
Well, that's the thing. I stand by this. I'll always take free calls, take a free call from a dentist, even if we
Good
have to
man.
do it, we didn't finish and we got to go into a second call.
Hmm.
There's no cost for that. If you want to hire me for a few months, of course it's going to cost a little
Yeah,
bit.
time.
Yeah, well, I charge a little bit because when I didn't charge, when I for about a year, I didn't charge anything for couple of months of coaching. And what happened is that the dentist didn't do what I wanted them to do. They didn't come to the phone. They just didn't value what I was giving them. I mean, I've doubled and
Yeah.
tripled dentist incomes and their happiness, according to what, the testimonials they give me.
Hmm.
I'm so it's worth something, and I had to get a dollar figure on it. So I figured, well, my assistant was making, I don't know, 4 grand a month. So
Hmm.
all right, that's what I'm trying. I'm worth at least an assistance
Right, right.
thing, but I'm not here to make. I've already made my money in dentistry. I'm here to pass the torch on and show them that you
Hmm.
don't have to dislike dentistry. When I was worried about making money in my 20s and 30s, my diet, physical activity, strong social connections weren't good. It was a high stress. That's the opposite of the blue zone. Blue zone is putting your diet and having enough time for physical activity. Well, you have
Exactly.
to have a balance, right? You can't be doing um, dentistry, seeing 20, 30, 40, 50 patients a day and have time to make your food properly, shop for it, do your physical activity and your strong social interactions. And you're always under high stress. So I had to do the opposite of what I was doing. And I was so much happier. So by accident, I found a blue zone formula I guess, out of necessity. I
Yeah,
don't I probably would have been dead by now from
yeah.
the way I was working.
Well, you're a treasure, and I appreciate knowing you. Any questions? Anything I left out?
Yeah,
Any questions for me? I got a blue shirt.
yeah, very, very good. No, keep up the good work and
No.
getting
I
your
ap
knowledge
I
to people.
appreciate you. We'll talk soon off camera, and I'd like to call you as a new friend, and maybe we'll get you out at sea. I know you're in Florida now. Is that your are you a snowbird? No Chicago when it
Oh,
gets
no,
cold?
no, Chicago. I've been down here full time for 6 years. We had a place on the beach for,
Okay, cool.
25 years, and it's like, this is the logical place to go. It's such a nice lifestyle down here.
Yeah, on a short note, I always would tell folks what defines a third world country is if a cup of oil or a cup of water is more important to you. It
Yeah.
seems like you found your cup of water.
It is I know that the news makes it look like, hurricanes, the whole Florida's going into the ocean, but, the problem is the news always puts people that live in flood zones. Well, of course, there's gonna be catastrophes. People that don't live in flood zones here, there is really no problems.
I appreciate you. Thank you.
Thank you.
And I'll talk to you soon.
Okay, thank you.
All right. Okay. Bye bye.